Hemodialysis is a life-sustaining therapy for patients suffering from end-stage kidney disease. However, hemodialysis also means repetitive physiological stress for patients. As blood and its constituents leave the patient's body to circulate through the extracorporeal circuit of the dialyzer, they are exposed to multiple artificial surfaces. The membrane is at the center of the entire dialysis procedure and represents the largest surface area blood is exposed to. The interaction of blood components with artificial materials leads to various undesirable reactions. Consequently, research efforts focus on rendering membrane materials more blood compatible. Blood is a complex and highly sensitive body tissue. The triggers for adverse events in response to blood material interactions are equally complex and begin with instantaneous adsorption of proteins to the blood contacting membrane surface. This adsorbed protein layer, often referred to as the secondary membrane, includes large proteins such as immunoglobulins, serum albumin, and fibrinogen. The composition of the adsorbed layer determines the extent to which subsequent reactions occur, such as the activation of complement and leukocyte pathways, the coagulation cascade, and platelet adhesion. Importantly, secondary membrane formations, although contributing to improved hemocompatibility by passivating the membrane surface, could impair the efficiency of toxin removal throughout the dialysis session by clogging the pores at the blood contacting surface. Let's have a closer look to understand some of the physiological processes that are known to be triggered during dialysis. The complement system involves approximately 30 plasma proteins, which together with leukocytes have the primary function of recognizing and removing foreign substances. This is achieved either by direct lysis or by mediation of leukocytes in inflammation and innate immunity responses. Of the three known complement pathways, the alternative pathway is triggered mainly by foreign surfaces, like dialysis membranes. All activated complement pathways have the enzymatic cleavage of C3 into C3a and C3b in common, as well as the highly inflammatory end product C5b9. Such fragments and soluble peptides may bind to adsorbed proteins on the membrane surface. All complement fragments have been shown to bind to leukocyte receptors, triggering inflammation, including pro-inflammatory cytokine release. Additionally, the adhesion and activation of leukocytes lead to the release of poly-morpho-nuclear elastase or tissue factor. Membranes also activate the intrinsic pathway and plasma kallikrein-kinin coagulation systems. Kallikrein and bradykinin can activate leukocytes or stimulate the production of nitric oxide, TNF-alpha, and interleukin-1, further promoting inflammation. Watching this video, you saw that blood material interactions involve highly interconnected activation pathways of complement, coagulation, leukocytes and platelets, which collectively amplify inflammatory processes. Increased knowledge is crucial towards the pursuit of more hemocompatible membranes, which we shall examine in the next video.